Сейчас мы познакомимся с доктором Sema Anak, которая является главой Центра пересадки костного мозга. Hello, doctor.
Nice to meet you.
Doctor, please tell us about the procedure, how the procedure of transplantation flows.
We usually get the patient either at the beginning of their treatment, for example, leukemia treatment. Then after we get the remission and everything, we transplant, or some people send us the patients for transplantation. Two kinds of people are coming here. For our own patients, it's a long procedure, not only leukemias, but some anemias like plastic anemia, aplastic anemia, some congenital disorders. First, we diagnose and try to treat till the remission, and after that, we decide for bone marrow transplantation. We have a special commission for that, and after that, we go on with the procedure. For the people who come from abroad or from other hospitals, first we check their diagnosis, and if they need some more treatment, we give that treatment first, and then we go on with bone marrow transplantation. For bone marrow transplantation, there are two types of procedure. One allogeneic transplant, one autologous transplant. For solid tumors, where we want to give high-dose chemotherapy, we use autologous transplants. First, we collect the bone marrow of the patient, then treat the patient with high dosage of chemotherapy, plus or minus radiotherapy, and then give back the bone marrow to cure the bone marrow and to cure the patient. For allogeneic bone marrow transplantation, of course, we need a donor.
Yeah.
We prefer siblings. That is our main aim. If there are any brothers or sisters, we try to use them if they have matching HLA group. But whenever there is no sibling or not matching, we go on with the procedure of searching bone marrow donors all over the world.
Yeah.
There are about 32 million donors or who wants to donate people all over the world. And they're all connected by computer systems. If we need a donor from that system, after we get the HLA, we send it to the computer system and get the matching. If there are any possible donors from the world, we get a list and we decide if we want to use them. We only know their sex and age. Otherwise, we don't know the donor. They're only numbers. This is important for all the world. Then we decide, okay, this is suitable, and ask to the center where he or she belongs if we can use that donor. They ask the donor because they can change their mind and they say, okay, I don't want to give anymore. If they say, okay, I'll be a donor, then the procedure starts. We send blood sample of the patient, they send the blood sample of the donor to our centers. And we check if they are really matching. If we get the result as matching, then we say, okay, we'll use this donor, and we give 3 dates. This. They choose from that 3 dates, and maybe the donor says, okay, 17 of this month, I'll be ready. Then we take the patient and prepare the patient. We call it conditioning regimen with chemotherapy, and so that we can clean all the bone marrow, nothing left, and suppress the immune system. And at day 0, when this is finished, they bring us the bone marrow or peripheral stem cells by courier system. It is interesting system.
Yeah.
They bring it and we give it to the patient. After that, there is a period of 1 month about inside the ward where everything is highly controlled, the air, the food, everything. There we wait so that the stem cells get increased in numbers and also mature. When we have the needed numbers, we call it engraftment. Then, okay, we are successful, and we control it by chimerism, where we get the donor and the recipient together and see which is there. And if it is highly, 99%, the donor, okay, it is engrafted. After that, we get the patient outside. But this adventure, we may call, goes on about 1-2 years, because there might be side problems like graft versus host disease, veno-occlusive disease, infections and everything, till the immune system gets intact. And after some time, when we realize that the patient is okay, no side problems, we vaccinate them, for example. And in about 1 year, these procedures finish, maybe 2 years. Then the patient may go back to their normal life. May go back because there is a school problem, there is education problem, if adult, the family problem, whatever you like. So it takes quite long, the rehabilitation you mentioned, for many years. But at the end, most of these patients are saved whenever they would die without this procedure. I can't give exact numbers for this procedure because every illness is different. For leukemias, it goes up to 70%, 80%, but for some diseases, we are happy, for example, the relapsed patient, for 50%, because otherwise they'll all die. So we said, okay, 50% is a success. This changes. There are norms of the world, and whenever we catch those numbers, it is good enough for us, and we try to cure all these patients.
I see. Thank you for this information. And I have one more question about patients. Do you have international patients from Russia, Ukraine, Kazakhstan, Uzbekistan?
Many of them.
Many of them.
Many of them. We started with Georgian people first, and the first patients came from there, and after that all the other countries, Ukraine, also North Iraq, the Kurdish people, Kazakhstan, and so now more are coming from other Middle Asia countries, Balkanian countries. Numbers are increasing. Also Libya, Algeria, they are also coming from those countries, and we try to treat these patients accordingly.
Yeah, and for how many years, your working experience, for how many years you treat patients?
Oh, it's a long story. This is my second job, to tell the truth, and I am here since 5 years. But my bone marrow transplantation adventure started in 1987. I first went to UK and learned about bone marrow transplantation there for 1 year as a fellow. Then came back in 1989. We had the first bone marrow transplantation center for pediatric patients in Turkey. So this was a starting point. I am happy I am the first in this procedure. And now about for 30 years, we are doing bone marrow transplantations, maybe in different places, but my personal experience is almost now 600 patients and increasing in numbers. And all of our team are like that. They came from different centers, but all of them are educated for bone marrow transplantation, and they have good experience, also hundreds.
That's great. Thank you very much, doctor, for all this information and for your time. This is a really honor for me to hear from you this information.
Thank you very much.
And I hope to see you
We also.
Thank you very
Thank
much.
you very much.